So in the case of different cardiovascular diseases, we have to study about some different type of diseases. The first one is the jaundice. Now, jaundice is not in the proper sense, it is not a cardiovascular disease, but a symptom that involves yellowing of the skin. Everybody knows what is jaundice or manjapitha. And during that time, what happens? There will be yellow coloration of your skin, mucous membrane, and eyes. If you don't know how this jaundice is seen, I will show some pictures of that. So in the case of jaundice, the main symptom is that this is how the jaundice is not normally appearing. Here you can see that there is be yellow coloration of your skin. So here you can see that in the beginning stage there will be yellow coloration of your eye. So this is what is actually the jaundice. So here you can see that jaundice is causing yellow coloration of skin and the mucous membrane. Mucous membrane means for example, our lips, the inside of our mouth. All these will be having, here all mucous membranes are there. Here you can see that. So this is the problem with the jaundice. And what is the cause? Actually, there is a higher level of bilirubin. Bilirubin is a pigment produced by your liver or bile pigment. So higher level of bilirubin will be present in your blood and that will be causing this yellow coloration. The color of the bilirubin is yellow, that is why it is causing yellow coloration. And bilirubin is normally a pigment produced from the breakdown of RBC. RBC will be in the final stage converted into another pigment, a type of pigment known by the name bilirubin. So it is from RBC bilirubin is actually forming. Now what are the causes of this yellow coloration of skin as well as this eyes, mucous membrane, etc. Normally, while jaundice is not a disease, it is only a symptom. Just like fever is not a disease, fever is a symptom. When you have some infection in your body, that will be resulting in the higher body temperature, which we call as a fever. Here also, this jaundice is a symptom, not the real disease. So while jaundice is often associated with the liver disorders, normally hepatitis and cirrhosis, it can have an indirect connection with the cardiovascular health. So most of the time, jaundice is the resulting is from the failure of the liver. The liver is not working properly. For example, I will show you the picture of hepatitis. So in the case of hepatitis, it is a disease affecting your liver. If liver is not working properly, that will be resulting in the formation of more bile pigment, and that more bile pigment will be leading to jaundice. But heart failure can also lead to liver congestion. For example, if your heart is not working properly, that will be creating stress on your liver, and that will be leading to improper functioning of your liver, and that will be leading to increased production or increased accumulation of bile pigments in your blood. So that is the case of jaundice, and this will be impairing liver's ability to process bilirubin, leading to jaundice. So this is how the jaundice and heart functioning. That is, if there is some kind of heart failure, your liver will be affected. And liver is actually the organ that is producing the bile, and it will be stored in another gland known as the gallbladder. So these bile pigments are actually produced by liver. Anything that affecting the liver, for example, in case of heart failure, the liver will be also affected, and that is how this jaundice and heart failure are actually connected. So symptoms are yellowing of the skin and eyes, and dark urine will be there. Stool will appear more pale. Normally our excretory matter of the stool is yellowish in color because of the presence of bilirubin in that. When bilirubin is not reaching the level of, in the case of jaundice, what happens is that most of the bilirubin will be present in the blood and that will be causing yellow coloration. So that sufficient quantity of bilirubin may not be reaching the feces or the stool, and the stool may appear more whitish, and there will be more fatigue will be there. More tired, the person will be feeling more tired. Jaundice is in the mild state, it is not a big problem, but in a severe state, jaundice can lead to death. So relevance to cardiovascular health, jaundice can indicate underlying condition that may affect the cardiovascular system, such as hemolytic anemia or congestive heart failure. Hemolytic anemia means that there may not be enough amount of blood cells. Here you can see that there is a hemolytic anemia. The main factor of hemolytic is a blood disorder that makes the RBC cell break down or die faster than normal. So in this hemolytic anemia, this is what is happening. RBC will be dying faster than the normal life. It's normal life. That is what is happening in the case of hemolytic anemia. So that is the problem with the hemolytic. Then congestive heart failure. Congestive means, I will show you what is this congestive heart failure. So in the case of congestive heart failure, when the heart is unable to pump blood throughout the body efficiently. So that is what is happening in this congestive heart failure. So these are the two different situations that can lead to jaundice. Now we move to the next disease, that is atherosclerosis. In the case of atherosclerosis, it's a condition where arteries become more narrowed and hardened due to buildup of plaque. And I will show you a picture of how this atherosclerosis may be appearing. So in the case of atherosclerosis, you can see that. So here this you can find there are now here. This is a good picture of the atherosclerosis. So what is happening here? You can see that inside the blood vessel there will be deposition of the cholesterol or fat particles will be there, and that will be leading to the reduced diameter. Here you can find what is happening here. You can see that in case so in the case of this atherosclerosis, there will be increased deposition of this fat particles inside that. That will be causing narrowing of artery. So this is the normal artery. When cholesterol is deposited like this, artery becomes narrowed, and that is known as and that will be preventing the flow of blood, smooth flow of blood. So that is what is happening in this atherosclerosis. It's a condition where arteries become so in this atherosclerosis, arteries become narrowed and hardened. When it is getting hardened because of the deposition of fat. So fat particles in the inside the blood vessel will be hardening your blood vessel and building up what is known as a plaque. Then what you are seeing here is known as this is the plaque, and that will be reducing the elastic property of your blood vessel. Normally your blood vessel can expand, it is flexible because that is how there is formed a very soft tissue. But because of the presence of too much fat particle inside, this expansion ability of the blood vessel will be reduced, or flexibility of the blood vessel will be reduced, so that blood may not be able to flow properly. It will be also affecting the pressure of the blood inside. So that is what is happening in the case of atherosclerosis. Now, what are the causes of atherosclerosis? One is high blood pressure, high cholesterol level, smoking, diabetes, and sedentary. Sedentary means sitting lifestyle. Nowadays, the modern life is mainly sedentary jobs. Everywhere we are sitting before computer. In the earlier times, people are not using computer much. Most of the people will be engaged in some kind of physical work or some kind of factory work. for agriculture work. Now even if you go to some factories, most of the factories are fully automated. Now the automation level will be increasing in the next decade because of AI, so that people become more and more sedentary. So that is the main reason for this kind of problem. Now symptoms, what are symptoms? Often asymptomatic. Asymptomatic means there may not be any symptom, absence of symptom. So there are no symptom externally in the early stage, but however as it progresses it can lead to chest pain. What is a chest pain? And pain in your heart or in the chest region. Then shortness of breath. The person may not be able to breathe properly, or even heart attack and stop. So that in the later stage that will be leading to heart attack or stroke, that is rupture of blood vessel in your brain. Now what is the impact of atherosclerosis? Atherosclerosis can lead to serious cardiovascular problems such as coronary artery disease. Coronary artery disease means, I will show you a picture. What is a coronary artery disease? So in case of a coronary artery disease, there is a type of blood vessel known as coronary blood vessel. This coronary blood vessel, here you can see that. So in case of coronary blood vessel, here you can see these are the blood vessels which are present in these are the coronary blood vessel. And these coronary blood vessels are the blood vessels which are pumping blood to your heart muscle. Here, why if there is any kind of atherosclerosis or block, here you can, this is what we call block. Because fat particles or cholesterol particles are deposited that, so that the blood vessel which are supplying your heart muscle may not be able to supply enough amount of blood, and heart may suffer a lack of oxygen and lack of blood. So that will be leading to failure of heart, and that is known as a heart attack. So that is what is happening in this coronary artery disease. Then peripheral artery disease, and the type of peripheral artery disease. This is peripheral artery disease. Here you can see that. See, these are the peripheral. So that will be affecting mainly on your external part of your skin. Here also you can find the peripheral artery disease. So here also you can see that. So what you are seeing here, see, this is the peripheral artery disease. The blood may not be going to the peripheral area. Peripheral means outer area. So that there will be pain in your legs, and legs may not be able to, you may not be able to move. Here also you can find that lot of blood, a lot of fat particles are deposited inside that. So these are the problems in the case of this peripheral artery disease. Then another type is aneurysm. Aneurysm, I will show you the picture of aneurysm, how this aneurysm may be. So this is the aneurysm. See, this is what is happening in the case of aneurysm. See, some kind of bulging will be there. See, this kind of bulging may be there. So this is known as the aneurysm. So this is the aneurysm. See, this is the blood vessel, and some kind of bulging is occurring, and that is known by the name aneurysm. So these are the problems that will be caused by atherosclerosis. So normally what is happening is that if there is some kind of block here, if there is a block here, blood may not be able to go to that region. So it will be accumulating at the lower side and causing bulging. So that is what is leading to aneurysm. So that is how the aneurysm is caused. Then it is a cause of heart attack and stroke. So that is the case with the second disease known as the atherosclerosis. Now third disease is known as a myocardial infarction or heart attack. In case of myocardial infarction, commonly known as a heart attack, occurs when blood flow to the part of the heart is blocked, and usually by a blood clot leading to damage or death of the heart vessel. Almost similar to what is happening in the case of the atherosclerosis. And the causes of myocardial infarction is caused by blockage in one or more coronary artery. Earlier I told you what is a coronary artery. a blood artery that is supplying your heart. Our heart muscle is known as a coronary artery. And here also symptoms are somewhat similar. Chest pain will be there, angina will be there, shortness of breath will be there, nausea will be there, vomiting, and pain in jaw, neck, and back. So these are the areas where this heart attack will be affecting. Some heart attack are sudden and intense, but many start slowly with a mild pain and discomfort. I will show you how this angina is affecting. See, here you can see that angina typically. See, this is how the see here you can see that this is a person affected by angina. Angina. See, normally when you have a heart attack, there will be pain in this part. Your left side is normally having. The right side may not be having much problem. Left hand and left shoulder and left chest all will be affected by pain. So that is known as angina pectoris, and this angina is known as a heart pain, is an indication of the heart attack. But in most people, heart attack comes very, very slowly. It takes over a period of several hours. And if the person is reaching the hospital in time, most people can be quickly treated properly. But sometimes heart attack comes very fast, very quick, and that will be leading to more complication or medical complication. So that is the known as a myocardial infarction. So myocardial infarction is a medical emergency or heart attack. Without prompt treatment, it can result in significant damage to heart muscle, leading to heart failure, arrhythmia, and even death. So these are some of the problems with the myocardial infarction. Then we have one more, that is the thrombus. Thrombus is actually a blood clot. Here I will show you how it is a thrombus. This is basically a blood clot. See, this is a thrombus. Thrombus is a clot forming inside. See, here you can find it. These are all thrombus. See, here you can see that a blood clot is formed here. See here what is present. See, this is also a good picture of that. So this is the thrombus. See, a blood clot has formed inside your blood vessel. This is known by the name of thrombus, a blood clot that forms in a blood vessel or within your heart. If thrombus breaks loose and travels through bloodstream, it becomes embolus. For example, if this thrombus is moving, this clot is moving through a blood vessel, then we call it by the name embolus. Embolus. Basically, both are same. One is situated, one is not moving, other is only moving, other is moving. So blood clots can form injury to the blood vessel, slow blood flow, or hypercoagulable state, like after a surgery in certain genetic conditions also. So these are the main problems of the thrombus, and the symptoms are mainly depending on the location of the thrombus. A thrombus in a leg vein may cause pain, swelling, and redness. Deep vein thrombosis. I will show you how to say deep vein thrombosis. For example, sometimes see deep vein thrombosis of the leg. Here you can see that. See what is happening here. You can see that will be leading to, see, this is what is happening in the, for example, any kind of thrombus in your blood vessel. If a thrombus like this is happening in your blood vessel, that will be leading to a situation of, see, the blood flow may not be taking place properly here. So that will be leading to the accumulation of blood here, and slowly you can see that the person leg will be gradually swelling. So this is known by the name deep vein thrombosis, and that will be leading to, see here also you can find. These are some of the symptoms, see, of the deep vein thrombosis. So this is the problem with the thrombus. If the thrombus is moving, we call it by the name embolus. A thrombus in heart attack can block blood flow and lead to heart attack or stroke. If the thrombus or blood clot is taking place inside your heart vessel, that will lead to heart attack. So thrombus can be life-threatening condition like pulmonary embolism. Pulmonary means lungs. Any blood vessel that is going to lungs. If there is a clot inside your lung blood vessel, that is known as a pulmonary blood embolism. Then it can go to heart attack or as myocardial infarction, or if it is happening in your brain blood vessel, that can lead to stroke. So these are the complications of the stroke. We have to see what is a stroke also. So in the case of stroke, we have two types of strokes are the one is ischemic stroke and second one is the hemorrhagic stroke. So in the case of ischemic stroke, I will show you a picture. If there is a picture, maybe a picture. In case of ischemic stroke, here you can see that. See, the different types of strokes are there. So in the case of ischemic stroke, here you can see that this is the ischemic stroke. Another is hemorrhagic stroke. So one is ischemic stroke and second one is hemorrhagic stroke. So in this ischemic stroke caused a blockage in blood vessels supplying brain, often due to thrombus. So some blood vessels which are supplying your brain is having a block inside. Second is by the rupture of blood vessel. See the difference between that. Here what happens is that there is a block here. So that part of the brain cells here may not be getting sufficient blood. In the second type, hemorrhagic stroke, a blood vessel breaks down. So that lot of blood will be lost into your brain, and that is known as a hemorrhagic stroke. So both are causing damage to your brain tissue. So that is the effect of the stroke. So in the case of stroke, there will be sudden weakness, numbness in face, arm, leg, especially on one side of the body. The person may not be able to speak properly. He may not be able to see properly. He may not be able to walk properly. Then there will be severe headache. All these are symptoms of the stroke. So if the stroke is happening during night, the patient may not be able to communicate this with anyone, and that results in death of the person. So stroke can lead to long-term disability or death. Sometimes people can recover after a stroke, but it depends on age. In a younger person, stroke can, most of the younger person be recovering. But if you are above the age of 80, the chance of recovery decreases. So these are the situations of different type of cardiovascular disease. We have stroke, thrombus, myocardial infarction, atherosclerosis, and jaundice.